All right, thank you for staying with us. The devastating consequences of drug abuse are well documented, ranging from anxiety and depression to addiction and even death. With a staggering 14.3 million Nigerians caught in the grip of drug abuse, according to NDLEA statistics, the agency's work is more crucial than ever. Since its inception in 1989, NDLEA has been at the forefront of holding criminals accountable and educating Nigerians about the dangers of drug abuse. Recent intensified efforts, including high-profile arrests at airports and on the road, suggest a decline in the drug-related cases. Joining us via Zoom is Femi Babafemi, Director of Media at NDLEA, to give us more insight into their efforts. Good morning. It's good to have you join us on the program.
Good morning. It's my pleasure.
And we must say well done on the efforts being made so far. We've been seeing reports of arrests and some other matters that has to do with the matters of drug trafficking and drug abuse. But first, talk to us about how reaching these efforts have been in the fight against drug trafficking and abuse in Nigeria.
I'd also like to appreciate TVC for the support always by helping to actually amplify some of these activities, thereby raising the consciousness, the awareness within the populace. We must appreciate that. Now, responding directly to your question, I'll tell you that indeed there are two broad ways that the activities of the agency have actually impacted on this whole effort. One is the drug demand reduction, where we actually carry out a lot of sensitization activities for those who are struggling with substance abuse, and then reintegrate them back to their families and the society. That's on the one hand. And on the other hand is the supply reduction leg of the effort, which that's the area where we have the actual law enforcement, the arrest, the investigations, the arrest, the seizures of these illicit substances, the prosecution, and even the tracing and forfeiting or forfeiture of the assets of these elements to the government. That is process of illicit drug transactions. So those are the two broad ways. Now, on the first leg, which is the drug demand reduction, I will actually say that indeed on June 26, 2021, the agency launched what we call the War Against Drug Abuse Social Advocacy Initiative. That is to mobilize every citizens, every stakeholders to buy in and take ownership of the fight against substance abuse and illicit drug trafficking. And since then, every week, we have our commands across the country, that's in all the states of the Federation, including the Federal Capital Territory, and other special area commands also across the country. They work in partnership with the civil society organizations, non-governmental organizations, faith-based organizations, community-based organizations, to take these messages to workplaces, to worship centers, communities, and even motor parks, everywhere, every nook and cranny, to sensitize the people, to let them know the dangers involved in abuse of these illicit substances. And we're glad that indeed that's really making impact. So far, I'll say that in the last 3 years, we've had more than 6,000 of such sensitization activities in schools, in worship places, in communities, markets, motor parks, and all of those places. More than 6,000, I think precisely 6,432 of such activities in the last 3 years. That's huge. That's a lot. And so with this, we're also fostering partnership with the local communities so that everybody can be on board. That is the area of prevention, sensitizing the people so that they can know the dangers of getting involved in this and thereby preventing them from going into it. And for those that are already into this, now the agency has also gone further. That is, those that are already struggling with substance abuse, either at the level of experimentation of those already depending on this. We also have treatment and counseling centers, 30 of that across in our commands across the country. We have 3 new model ones coming up before the end of the year, in addition to the already existing 30, where people can walk in and get support and get psychosocial services, get counseling, get treatment. We do this every day. That's we have quite, and so far we've had, in the last 3 years, more than 33,000 persons, excuse me, have also gone through these treatment centers across the country in the last 3 years. In addition to that, and when these people go through, we also try to follow up to ensure that they are properly reintegrated back into their families, into their communities, because there are quite a lot of factors responsible for them going into this ab initio. So we'll try to see how we can address some of those issues with their families and with the host community. So all of these are handled at that level.
All right.
And for those who may be afraid of, okay.
Thank you for that. Well, you've mentioned a lot of things, the advocacy, awareness, and also rehabilitation of the NDLA, which are actually good, factors to consider in tackling the drug, crime in Nigeria. But let's talk about some of these dealers and how well they have really evolved. Well, we've seen videos, and for one of the videos even playing on the screen is showing a hair cream. We had a video also, showing also sanitary pads. This shows that while the NDLA as a government structure is evolving, these dealers are also evolving and finding better ways or new ways to, move these items even beyond our borders. So in terms of, the gender involvement, I would like to understand that.
Yeah, what you have seen simply is the result of their frustration and at the same time their desperation. Frustration in the sense that they've tried every nook and cranny. They've tried everything. The seaports are blocked. The airports are blocked. The land borders they've turned to. We've established presence in all of those places. I'll tell you categorically, and I think I can, with all sense of humility, boast of this, that indeed the NDLA of today, the modern NDLA, has indeed transformed to, an agency globally recognized, globally respected, with 100% intelligence-led operations and with a lot of capacity and capability. And as a result of this, we're making things very difficult for them. And so out of that frustration and desperation, they have to go to some of these things that you've seen. Just like the one you just spoke about, that's getting these illicit substances into sanitary pads and even hair cream. And to add to that, they're not just taking this by themselves. They're trying to package them and take them through courier companies. Unfortunately for them, they do also know that we're very much present there because we walk ahead of them. We're steps ahead of them. So we always anticipate where they want to turn to. If we block this place, they want to turn to this. And so because we work with a lot of intelligence and with a lot of technology, with great professionals, men, officers and men who are well trained globally. So all of these things we anticipate, and we're able to make sure we continue to squeeze the space for them until they really have no place to turn to. And that's why you can see in the last 3 years, we had more than 52,000 arrests. That's probably one of the highest anywhere in the world. With apart from that, again, we also had more than 9,000, specifically 9,034 persons properly prosecuted and convicted 7 jail times. That's also one of the, probably, if not the highest, one of the highest anywhere in the world. So this is the kind of things we're doing to ensure that we keep our communities, our country safe from this element, so that they don't have anywhere, any means to move in drugs or even take drugs out. Let me also inform you that indeed, as a result of the activities of the agency, now they tried to avoid from the intelligence we gather, from all of the information we gather, both locally and internationally. We know that they are now afraid of coming directly to into our country because of the activities of the NDLA. And so they try to establish their footholds in some neighboring countries, through which they then want to be smuggle these things in bits, in 10s, 20s, 30s, 1,000 and so. And so we already got wind of this, and that's why you would have seen also of recent, we've been making arrests at our land borders where when they are trying to come in or when they are trying to take these things out. So we're very much on top of this, and we're squeezing the space for them.
Absolutely. Now, when you mentioned the matter of collaborative efforts earlier, I was hoping to hear that the agency was also collaborating with the education sector, talking about schools, tertiary institutions, and all of it. Because when you look at the number of persons said to be involved in drug abuse, that age bracket fall between persons in secondary and tertiary institutions, but then we can also catch them young if we go to primary schools as it is, because they might be exposed to some substance abuse by either their parents or guardians. What effort is being made with regards to this aspect?
Absolutely. I'll tell you that indeed our war against drug abuse, WADA social advocacy initiative, cuts across all strata of the society, from the elementary, primary, secondary, tertiary, all across, including the out-of-school children. We cover all of these places, and that's why I did mention earlier that indeed our commands, our formations across the country, because we have presence in every nook and cranny of this country now, because the agency itself has tripled in size at the moment, and so we have a lot of presence in all of these places, and so we work with school authorities, whether at the level, at the primary, secondary, and that's why we have in schools we have what we call WADA clubs. WADA clubs, they are just an association of students. That share the same ideas, that share the same thoughts on the issue of drugs, coming together to work with the agency, to work with the school authorities, so as to continue to educate themselves, so as to continue to also influence others positively, to have a good peer influence on others. And so with this, all of these things established in schools every time, every day, we have quite a lot of non-governmental organizations and civil society organizations working with us that have their focus in this area, working with us in this area. And then apart from that, we have also added another thing, and that is the issue of drug integrity test, which we have also taken across the country, starting from the homes. Now, just like people sit in the comfort of their homes and conduct sugar level tests or conduct other minor tests on themselves, on their wards, we've also introduced these test kits, drug integrity test kits for families right from the homes. When they we're glad we're getting good feedback from a lot of families, from a lot of homes, and from a lot of institutions where this is being applied. Now, what this does for us is, one, to detect early when these young ones have started experimenting. And when they are detected early, it is better addressed early before it aggravates to the dependence level, to the addiction level. And again, another thing is the fact that your child, your ward, knows that you have these kids at home, and you can always, or in school or in workplaces, and you can always gather people. The agency, the NDLA itself does it. The chairman could come anytime and say, okay, gather people together in the hall. We need to, conduct a drug integrity test. And that has gone on across our formations. It's a key thing. And this we have also pushed, and we're extending to other institutions of government, to other, private sector and the like. So this is another thing. It creates that awareness, and so it prevents them from laxity or succumbing to negative peer pressure from their peers, from their colleagues outside. So this is another major step in this direction. Indeed, we are present, and we continue to push and partner with school authorities across board.
And in terms of ethical considerations and possibly media perception of the NDLEA, there have been so many concerns about the method of operation, for future of assets and all that. Would you say the NDLEA really in itself is, working in the interest of so many persons, especially in the interest of, rehabilitating? The focus is rehabilitating and not, on, arrest and for future and other things like that.
That's what I said earlier. Indeed, we have two broad areas. Our responsibility comes in two broad areas. One is the drug demand reduction. That is where we try to raise awareness, sensitize the people to prevent. And in the case that people could not be prevented, they have started abusing illicit substances, then we also have the mechanism, a system, a structure in place to also respond to that, to also take care of them, to also offer them support. And that's why I was trying to say earlier that indeed, even for those that are afraid of being judged or being stigmatized, that cannot walk into a physical structure for treatment to seek support, we also have a 24/7 call center where people can sit in the comfort of their home, get the same psychosocial support services. All of this we have on the one leg. Now, the other leg, which is the law enforcement, that is where actually we get involved in arrest, seizures, prosecution to ensure that we cut the supply of these illicit substances. And beyond that, to also go after the assets, because we know that one of the greatest motivating factors for people that go into this criminal trade is the proceeds, the wealth they intend to acquire from it. And so, as a way to cut that motivation, what we also do, apart from, because some people can afford to say, okay, you can send me to jail 5 years, 10 years, as long as my bank accounts are still intact, as long as my properties are still intact, they don't mind going to jail. Even from their jail, they can still be controlling things outside. So one of the greatest things the leadership of the agency has done is to strengthen our assets and financial investigation to be able to make sure that we cut.
All right, I want to quickly ask this question because our time is almost up, and that has to do with the fact that Nigeria's geographical location as a country in Africa, between South Africa, America, Europe, and some other of these countries, has made it a kind of a target market for the infiltration of all of these drug traffickers and their activities. I'm wondering what the level of collaboration with these countries are. I know that Nigeria and Malaysia has some sort of arrangement. I don't know if we have arrangement with other countries to check the activities of traffickers who find Nigeria as a market for their, activities.
Absolutely. That's I'll tell you that indeed that's one of our greatest strengths at the moment, partnership globally. And that's why the agency, that's the NDLA today, is well rated and well respected, well sought after globally, because they know the level of professionalism and the level of dedication and commitment of the leadership and the personnel of the agency. I'll tell you that indeed we work very closely with our counterparts in the US, like the US Drug Enforcement Administration, USDA. We work very closely with the International Narcotics and Law Enforcement, that's the Bureau in the US also. Coming to the UK, we work very closely with the National Crime Agency. We work very closely with the Border Force. Again, the same thing with German police, the French police, the Brazilian police, Saudi, across Africa here. And in all of these places, we sign MOUs with these people that we share intelligence real time and will have joint operations in some instances.
Unfortunately, our time is up, but we must thank you, Femi Babafemi, Director of Media at the NDLEA, for your time on the program. Thank you.
It's always my pleasure. Thank you very much.
Right.